Hey everybody, today we're talking about, can fibroids prevent pregnancy? I'm Dr. Perkins. Let's talk about how these fibroids can affect you and everything you need to know about them. Let's come on in. So in our video today, we will talk about briefly what are fibroids and the prevalence and what you should know about them. We'll dive into how fibroids affect fertility. We'll talk about which fibroids are most problematic. And lastly, we will cover what to consider treatment-wise when you have fibroids and you're planning for pregnancy. All right, so what are fibroids? Fibroids are so common. If you are female watching this video, especially if you're in the reproductive age, there is a 70% possibility that you have fibroids right now. That is a majority of us. Just about a majority of females will have fibroids during your lifetime. Now, you may or may not be aware of them. If you are like me, I thought I was living life doing well until pregnancy, and I found out, well, listen, you have a mango-sized fibroid that is in your pelvis. Had no idea. And so a majority of females do not know they have fibroids until you're planning for something like fertility. Now, they're non-cancerous growths, and I say that, but know that 98% are non-cancerous. There's a very small subset that can be. As you go through your transitions in life, your fibroids will change. They are constantly growing and moving or changing in some way. And so on average, fibroids may grow 1 to 2 centimeters per year. And so if you knew you had fibroids 5 years ago, your fibroids could be 7 or 8 centimeters or even the size of a baby's head at this time. And so as long as you're reproductive and you've not been through menopause, they will continue to grow and grow and grow. And so they are quite common. Now, not all fibroids are created equal. Wherever they're located will make the biggest of difference when it comes to your symptoms, as well as the possibility of them affecting pregnancy. And so let's talk about that now. In our model here, I want you to focus in on the center because this area is the uterus. The uterus goes from the top here down to this location right here. The lower part of your uterus is the cervix. For pregnancy to occur, it's important that sperm travels through the vaginal space, through the cervix, into the uterus, to the fallopian tubes. And this is where pregnancy and conception actually occurs. That's where fertilization happens. Once an egg and sperm meets, they travel together, and the pregnancy is then established inside of the uterus. Now that is the normal pregnancy process. If you do have fibroids, fibroids can be located on the inside space of the uterus, right where baby should grow. Fibroids can be in the muscle area, and that's called an intramural fibroid. And just to mention, the ones that are located on the inside space of the uterus, those are called submucosal fibroids. In the muscle, intramural. And then you can have fibroids that are like on the top of the uterus, and those are subserosal. A fourth category would be fibroids that hang off of the uterus, and those are called pedunculated. If you're planning for pregnancy, it is very important to know where your fibroids are. So for instance, if your fibroids are in the inside space or submucosal, these are the worst and the most problematic fibroids because they are right in the area, one, where babies grow, so they're in the baby space. So imagine if you had a room and that's the baby's nursery and you have a big mass sitting in that space and baby needs to live and develop there, there could be a conflict. It's also problematic because in that space, that inner space of the uterus, this is where a majority of your blood flow goes because babies need blood flow. And so fibroids like to live there because they can get all the blood flow for themselves. They can get all the nutrients, all the oxygen, all the good stuff that your body is saving for a baby. They can have that for themselves and grow and grow and grow. So any fibroids in this inner space, the submucosal area, can be a problem for a possible pregnancy. When they're there, they can lead to miscarriages. When they're there, they can lead to things like placental abruption, where the placenta separates from the wall of the uterus. They can cause bleeding in early pregnancy or throughout the entire pregnancy. So usually, I would recommend, if you're aware of these fibroids in that inner space before you conceive, try to get rid of them first, because your uterus and your pregnancy will have a much better time with pregnancy with them not being there. I hope this makes sense today. It's been a pleasure talking about this topic, and we have so much more to talk about. So if you hang around on my channel, you'll see a few more videos that will talk about fibroids and fibroids in pregnancy. As a free gift for you listening in today, I would love to send you a copy of my ebook, Hormones Don't Lie, where we talk about hormones, fibroids, and everything in between, including how you can help to decrease the likelihood of your fibroids and all these hormonal conditions worsening due to our activity and our lifestyle. If you'd like that, click the link below and I'll be more than happy to send it to you. Thank you so much for joining us today. Leave a comment and share your experiences below, and join us for the next episode. I'm Dr. Perkins, a board-certified OBGYN, and as always, it's been a pleasure. Thanks for joining us.